Welcome to Over 55. I'm Ron McNish, your host, and today's first guest is Mary Carter of Bayshore Home Care. Hello, Mary.
Hi, how are you?
Great, thank you. Thank you for coming on our show. This is our last show, so maybe you can tell us about Bayshore and what you people do, because I know a lot of people are in home care, and what makes you unique.
Good. Bayshore Home Health is the largest home health care company in Canada. We have offices from coast to coast, right from Vancouver to PEI, and we are ISO registered. We also have been voted one of the best managed companies 6 years running, and we provide great care for people staying at home. We provide registered nurses, registered practical nurses, and personal support workers. As little as 1 hour of care to maybe keep a senior in their home rather than going into long-term care, up to 24-hour care if someone is coming home and is recuperating from an illness.
Which is important. I mean,
Yep.
we're all, we're all healthy until the time when we need something, then we start scrambling because we don't know where to go.
That's exactly right. And we try to encourage people to find out well in advance from your parents or even yourself what you have for insurance coverage, whether you do want to remain in your home as a senior or whether you do want to go to long-term care. People need to have that talk with their family members while they're still able to say what their wishes are and not leave it to the last minute and be at the mercy of the first people that you call.
Yeah, and we spend ages on a 1 week or 2 week vacation. We seem to spend hours and hours sourcing out that, but when it comes to our own health care,
we don't pre-plan.
We really don't pre-plan, and there's so many options out there and pitfalls probably, where they could call your organization and maybe you could walk them through it too.
Yeah, absolutely. And what we try to encourage them is, find out what your mom and dad want. Insurance may pick up some of the cost. Community Care Access Center is a great place to start. They will tell them, do an assessment and find out what services they may need. And it may not always be enough through CCAC. So if they approach an agency such as ours, we will do an investigation, find out what insurance coverage they have, and perhaps be able to get their insurance to pick up most of the costs for them. Every time we take on a new client, we do a free nursing assessment, and that's a care plan that will tell what you need. Once that care plan's done, you're under no obligation to take those services. It's a free plan that comes out and finds out what it is your mom and dad actually need, and at that time you can decide whether you want to go ahead with services or not.
And that's great. So they can go to CCAC, which is Community Care Access Center, who you are registered with. So you're a registered organization with them. And I didn't realize that, because that's a great service that you offer to do an assessment. Because again, we look in Yellow Pages, we go online, or however we try to find it, but coming to your organization or you coming to them, however you do it, it's got to be a lot less stressful. And you've been doing it for so many years, you know the pitfalls and the pluses, and I think the part of insurance is great too, because again, we always worry, do we have enough money to do it?
That's exactly right. And people aren't always aware of what insurance they have and what coverage. And we have a whole department at our national office that does nothing but insurance. So they can certainly look into their insurance for them, find out what their coverage is, what amount of money they have, and probably within 48 hours get approval if they have insurance to start that coverage up for them.
So that part's great on that side, but you also have the other part where you can do the companion, if someone needs companionship, which is...
And we talked about that earlier. They can take them to doctor's appointments. Sometimes family members aren't able to accompany a senior to a doctor's appointment, and they're not always sure when they come out of that doctor's appointment and mom and dad says, no, he said I'm fine, whether that's actually what he was saying or not. So sometimes it's kind of nice to have a nurse go along with them, be able to sit in and actually fill the doctor in on what's actually been happening, because sometimes dad will say, no, I've been fine, but we know for sure that he's had a number of falls, some dizzy spells, is not able to get around as well as he can.
And that's a great point, because, if you're going to a doctor's, and regardless of who you are, you may just zone out because the news, whatever it might be a shock or it might not, but sometimes you zone out and you leave the office and you think, what did he just or she just say? So that's good to have that support, because a lot of us don't think of that. We just go in and sometimes it's not good news, so we leave not knowing exactly what it was. And a good friend of ours that worked at our organization as a volunteer, they told him, he thought they told him he had 2 years, and it was 2 months.
Wow.
And, you know, I mean, it was
So if you have
sad.
somebody there taking the notes
Yes.
and making sure they've got that information correct to give back to the family member, it's a great asset to them.
So that's not the only services, because it's great that you're a huge organization across Canada, because then you have all the resources. So if I move from here to some other part of Canada, I could probably go to
It's a
your
seamless,
organization.
yeah, we can move that care plan directly to another office and provide it. But we provide, for some seniors, the difference may be just somebody to come in and do some laundry for them. They're on a 3rd floor apartment, their laundry facilities are in the basement, and they can't manage getting up and down the stairs or carrying a heavy laundry basket up. So 1 hour of service a week may be the difference between them staying in their home or going to long-term care.
We want to stay in our homes.
Yep.
Well, Mary, unfortunately, this just zooms, as I've noticed for the last few weeks. So thank you for coming on.
Welcome.
Stay tuned. We'll be right back with one of the over 55 members.